I'm Scylla, and this is Lorenzo. We are doctors looking for a way to combine our passion for medicine with our love for exploration. We picked up our lives and sold all our stuff to start a new adventure. Subscribe to follow along. Bread acquired. It's white bread, but it's the best that we can do. Ah, yes, and Brownie. He loves me.
So my task today was reorganizing this room. It's like the trauma bay, but it's also like the stock room. And it used to be just a mess, everything jumbled together. So I asked for some shelving units, and I'm just organizing and trying to, there's no like little containers, so thinking of clever ways to use cardboard boxes. I'm just gonna label here, and then that way people can see exactly what's inside, and labeling all the shelves here, because otherwise it's just everything is jumbled into cardboard boxes, unlabeled, and nobody knows what's in stock. And then I can start working on organizing the ER itself with just a few of each supplies so that we don't have like a bin that's full of nasal cannula. So before, there was a big air filtration unit that was still in a crate and covered in mold and unused. And so I had maintenance come, move that out of here, and then move the shelving units back and actually organize what's on them. So I organize it with IV supplies and syringes up top, the different types of fluids here, some gloves. We have some gauze. There's some ortho and splinting supplies. Here's some urinary supplies. You can see we're down to our very last urine specimen cup, catheters, plenty of plaster and Webril. Thanks to the Navy Mercy ship, they donated a bunch of those. Here I have the suturing area on this, oxygen mask and cannula, sterile gloves, intubation supplies, ET tubes. This is the trauma bay. The traumas come in from outside through there into this door, and they get put in this stretcher where they're evaluated. Not the best setup because this is a back room. It's not directly monitored, and the patient's out of sight. A lot of the items here are just not functioning. The maintenance of this room is kind of forgotten a lot of the times. This is the suturing supply station. There's some suture kits down there and some basins which look like they've been used. Intubation station. So the Mercy Navy ship donated this nice Braslo kit, and I've stacked all the different endotracheal tubes in it. There's the Braslo cart, which was empty when I arrived, but we've started filling some donation items into it, and they're divided by the size of the infant, so each color corresponds to a different weight range and size. And you can use the Braslo tape, which is a tape that we put next to infants to measure them, to decide which set of equipment, because every equipment is different depending on the size. So, pediatric bag valve mask. And here we have the ventilator, which is, I think you could throw this out of a helicopter and it would still work. It's like an old school military grade LTV 1200. And this is the only kind of status area here, and it just gives you alarms. But otherwise, you turn it on and you select your various settings. So you can do pretty much, mostly everything that you need. Pressure support, volume support, you can do BiPAP. We don't have the straps to hook up the mask for BiPAP, but we make do. One of the issues that I was finding was, even if we did have the equipment, like the monitor, the accessories were often missing or broken. So like this is the very last pulse oximetry cable that I could find in the hospital. And as you can see, it's in pretty bad shape. So once that goes, we have no way to monitor that on this monitor, but we use a handheld pulse oximetry. Just coming home from our first day. I was working in the ER. Scylla was seeing clinic patients today, and we're just pulling into our lovely resort hotel, which is very nice. And yeah, I was working with the ER doctor. We admitted 2 patients, saw some other patients, a lot of bread and butter cases. Very few diagnostic tests and very few therapeutics. For example, we have a CBC, urinalysis, and an X-ray. That's about all the tests that we can do. And ultrasound, thankfully. Very basic resuscitation stuff. There is a defibrillator. We have dobutamine for vasopressors. Ouch. What else? There's no lysis, so really no management for stroke or ACS besides aspirin. And yeah, it's kind of a scary place for sure, but we do the best what we got, and teaching and doing education along the way. So I'm going to prepare some lectures for the nurses and the doctors that I think is going to be pretty useful. So we're doing a mass casualty disaster drill, and we just got a call that an airplane crashed into the water. So we're heading into the ambulance and we're headed off to the scene of the crime. Are you guys saving lives? You saving lives? All the patients are back. We did it. We saved everybody except the ones that died. Well done.
My Sherpa.
Are you ready? So off to some after-work kiting.
To be fair, this is the first time we've gone kiting after work, and it's our last week in Chuuk. We go on our off days. Look at everything Lorenzo's carrying. And then look at me, the princess. Also, my shirt is inside out because he wanted to go kiting immediately. So now we're going kiting immediately.
There's Mercy Ship in the background over there. So there's nice white caps out there. The wind is a little blocked by that piece of land right now, but as soon as we get out, it's gonna be golden.